Hi, I'm Carolyn Gotay. I'm a professor at the University of British Columbia School of Population and Public Health. I'm a psychologist, and I've worked in cancer survivorship and cancer control for many years, including work on support groups. I came from Hawaii, where most of the work in support groups was based, and I had the opportunity to observe a prostate cancer support group and understand what made it tick. So that's something that I think has given me an insight onto this field of research that I'm glad to share with you. My experience with prostate cancer support groups derives primarily from a study that I did in Hilo, Hawaii. This support group was made up of a number of individuals, survivors of prostate cancer, most of whom were Asians or Pacific Islanders by ethnic origin. It was really interesting for them to accept us into their group, so we had the chance to do a qualitative study. I worked with my colleague, Doris Siegel-Matsunaga, and she and I published a paper about this study a few years ago, reporting some of the insights we had about the unique functionings of that group. Some of what we found surprised us, actually, because it was different from what had been reported in the literature so far on prostate cancer support groups. What we found, for example, was that the men who attended were not only there for information and learning more about their medical care, but they also came for camaraderie and support and sharing. And those are things that are sometimes thought as, traditionally, women's roles. But in this community, the men actually were at the group to get that kind of support. Now, this was a group that had been based with people who knew each other, a small community, kind of off the beaten track. And so some of the comfort and caring and connections may have stemmed from the experience they had in their community and feeling as they were part of a specific small town group. They didn't know each other ahead of time, though, so a lot of new connections were forged from this group. We were really impressed by the acceptance of all different styles of communication in the group. For example, one man really didn't talk. He just wasn't the kind of person who liked to talk, but he was a musician, and every once in a while he would play something on his ukulele, and it was something that the whole group could listen to, understand, feel what he was communicating, but not in words. So the tolerance of all different styles, some of which may be particularly common in Asians and Pacific Islanders, was something we were really impressed by. Both breast and prostate cancer support groups do share a lot of similarities. They're bringing people together who have shared a similar experience, who want to test out what's happening to them, understand what's going on with their quality of life from the perspective of other people who are experiencing the same thing. So I think the essence is actually very similar for both prostate and breast cancer support groups. However, they are different. The kind of problems that people are experiencing do vary. For example, the sequelae of the treatments that many men with prostate cancer experience are different from those of breast cancer. And concern about sexual functioning, incontinence, some of those issues are different from what breast cancer survivors typically experience. I also think that women and men do have different styles, and so a breast cancer support group, at least the ones I've been to, have really focused on women as women's health and women's style. There's variation within them, but there's a lot of, I think, emphasis on women together, whereas the men's groups fit what's significant to men. They're different. So the men may want to know more information. They have different styles of communication. I don't think that one size fits all for every support group, or for men and for women, but I think it's a comfortable environment that I've observed that evolves for these support groups, whether they're for breast or prostate cancer.